Let's get serious for just a minute.
Yes.
We love having you on. We don't have you on as much as we probably should because prostate cancer awareness is something that should be we should be cognitive and thinking about it a lot more than we normally do. And certainly two guys in our 50s here that do the show. But September is National Prostate Cancer Awareness Month. And we were just talking before the show, Clete. Man, you've been coming on with this for about, 4 or 5 years. The changes just in the last half decade have been miraculous. It's been amazing. Talk about it a little bit.
Yeah, absolutely. I mean, definitely men don't get tested.
And I think we lost Clete. Clete, you still there? I think Clete went through a dead spot, and we lost him, so we'll get him back on the air here. See if you can get Clete on the phone.
Yep.
I'll call him back real quick. It happens with technology, but I think we lost Clete there. Let me see if I can get it back on here on KCAS Radio. By the way, don't forget, not only is Vituro Health one of our great sponsors, but we also have all. Yeah, hey Clete, that's a. Hold on, let me get you back on here, and we'll get you back on. All right, Clete, go ahead, man. You're back on, bub.
Yeah, sorry about that. I don't know what happened.
That's okay.
So prostate cancer MRIs, the prostate used to be the only organ in the body that was blindly biopsied. Now you can even try to avoid biopsies by doing MRIs before you get a biopsy. So there's lots of those type technologies. Now they've got the PSMA that's coming on strong, which is another way. It's another kind of a PET scan that can detect prostate cancer. They also have treatments. The treatment has really been the biggest thing in that, most men go to a surgeon, they get surgery, they go to a radiation specialist, they get radiation. But there's a lot of new options out there that you can do focal treatment that can, the whole idea of treating prostate cancer is managing the disease and trying to keep your quality of life, because we all have those stories of men who had a Gleason 6 tumor and had it removed and have, all kinds of problems with it, with their body going forward. And it's just not necessary.
Clete Walker joins us here from Vituro Health. Talk briefly about, because I've got a ton of questions. I know Dr. Josh has got a bunch of questions too. We always hear about that word metastasize, where a cancer will go from one part of the body to the other, and usually it's through the bloodstream. And certainly I don't know what I'm talking about here, but you can certainly clarify that. When you're talking about a prostate, we always talk about finding it early. If you find it early, the success rate is much more. Can you talk about how cancer attacks the prostate and what can happen if you don't catch it early?
Yeah, I mean, so remember, I'm no doctor, but yes, I mean, catching prostate cancer early, the survival rate is very, very high. I mean, it's it's like 99%. I mean, it's very high, especially in the Gleason 6. Early means typically in the Gleason score means 6, so it's a low grade tumor. Gleason 7, Gleason 8, Gleason 9. So it goes up as it gets worse. And the real thing is if you catch it inside the prostate, so it hasn't escaped into the lymph nodes, or if it hasn't gotten into the into other parts of the body, then you definitely it's a high survivable rate, and that's why you want to catch it early. Once it gets outside the prostate, then the standard treatments that you would have for treating just a prostate tumor are have to be supplemented with things like radiation and other things that are used to combat cancer, and it becomes a much more serious disease once it's outside the capsule of the prostate.
Hey, Clete, talk about, because we talk about it when we talk about Vituro Health here, we talk about Vituro Health out there developing or working to develop new forms of treatment. But talk a little bit about the company Vituro Health, because we just sort of say what you do, and I think it is hard for people to understand where Vituro Health fits in the sort of health team with regard to prostate cancer.
Yeah, absolutely. So what we do is a lot of these technologies, when they come to the market, are not covered by insurance. And so your traditional practice doesn't know how to deal with a cash paying part of the world. And so, and not that I agree that it should all be cash when it starts, because I think insurance should come along much quicker. But what we do is we take on that cash and we bring new technologies to market. So HIFU, when it came out, which is high intensity focused ultrasound. We went out and bought all the equipment so the doctors don't have to do that. So we provide the capital, and then we bring the equipment around and we train the physicians on how to use it and make that equipment available at the hospital or surgery center in order for the doctor to perform that procedure. On top of that, we have a whole group that manages the patient. So we provide a patient care coordinator. We, answer any questions they have. We try to handhold those patients through the treatment and then through aftercare, because again, they're paying cash and they should be treated a little bit differently. It's very, very similar to what people think about when they think of concierge medicine. What's different about us is we're not sold on one technology. So we have HIFU, which is the one that we've had the longest. We now also offer the Tulsa Pro, which is another form of focused ultrasound that's performed inside of a live 3T MRI, and it's transurethral versus transrectal. And then we're also about to launch another laser that'll be done in the physician's office, and it'll be done in a focal manner. And it's a pretty cool treatment as well. So we want to be on that cutting edge of offering prostate cancer treatments that really focus on quality of life for the patient. Because that's what it's all about, guys. When you're 50 years old or even 65, you don't want to have your quality of life changed in your sex life or in your day-to-day life, where having to wear a diaper, any of those type things. We can avoid it. We should avoid it.
Did you just say? I just want to make sure I understood the one of that last treatment that you talked about. You potentially, or you're either potentially or you could have treatment, a minimally invasive, non-pharmacological treatment for your prostate cancer in your doctor's office.
That's right. Yeah,
wow.
It's
Wow.
a new laser, and it's a focal laser, and we're working with them now. It's already been FDA approved, but they're working on some software that we want to launch with it. And so we're doing some testing with it now. But yeah, matter of fact, it'd be done in the doctor's office, and it would be a fairly short treatment, around 40 to 45 minutes, where our current treatments last anywhere from 1.5 to 2 hours.
Just got a tweet question here. Please ask Mr. Walker about the differences between, say, a prostate cancer and any other type of cancer. Obviously, cancer is cancer, and it's a horrible situation. And there's obviously different types of cancer that attack different parts of your body. Basically, this question was, and it's from Phil in Hueytown, if this is something that is being so successful, and Josh even brought this up, when he started, it was 1 in 7 men. Now it's 1 in 9 men. We're seeing those numbers change a little bit. Is there something we can learn through prostate cancer awareness and how you're adopting and adapting to what you got to do to be successful in that, and how we can utilize those teachings in other cancers in our body? Or is that possible?
Yeah, I mean, I think that, the treatment, non-invasive treatments are becoming more and more available. You're seeing even focused ultrasound now has been used in, they're looking at kidney cancer, they're looking at breast cancer, they're looking at, matter of fact, there's a company called Insight Tech that does focused ultrasound for tremors, for Parkinson's disease tremors.
Wow.
And it's actually done very, very well. It's got KOCH has invested in that company. It's out of Israel. It's great technology. But there's a website called Focused Ultrasound Foundation, and you can go on there and see all the different parts of the body and different cancers that they're doing research on now to use these non-invasive procedures, because it is something that you can do. Matter of fact, if you go to that Focused Ultrasound website, there's a book there called The Tumor, written by John Grisham. And it talks about using focused ultrasound on a brain tumor versus having an invasive treatment and what the outcomes are for that patient long term. It's pretty interesting stuff. And so that is, but it's a great question. And I think you're seeing more and more institutions and academics look at ways they can treat non-invasively and not have to always go to surgery.
Clete, help our listeners with this one, because you've described this is a little more like concierge, but you're trying to make it more mainstream. You're working with selective physicians, urologists around the country. So a guy comes in, let's say he's diagnosed with prostate cancer by his urologist, and he's presented with treatment options, and whether he's listening to our show or I guess what I'm getting is a lot of times we don't want to call into question our urologist or our physicians, and we hear the treatment options. What should guys be doing to find out more if the treatment options that they're hearing from their physician, I don't know, are maybe not as appealing, or just, again, where does Vituro Health fit in there? Because I think it's a delicate, this is why I'm stammering, it's a delicate relationship between a patient, a physician, and a company like Vituro Health.
Yeah, I personally believe that we all have to look out for us individually. And, it's proven that doctors do what doctors do best. In most cases, a surgeon's going to be a surgeon. A practice that has a radiation facility is going to radiate in a lot of cases, and that's going to be your two options, okay, for prostate cancer. Sometimes active surveillance, which is watching it, is a great option. You do not have to necessarily treat all prostate cancers. So active surveillance is definitely an option. But when you have to have a treatment, I always tell people, do your research on your own. You really got to do your research. But a company like Vituro Health, you can call us, and you don't even have to, all you have to do is tell us what you have. We get a lot of these on the internet. They'll send us and say, hey, I just got diagnosed. I met with my doctor. This is what he told me. Could I have a second opinion? Could I talk to you guys? And we will immediately reach out to those people, and we will get them a second opinion at no cost. So there's no cost. They can, we'll hook them up with a doctor either locally or even a phone call or a telehealth visit. Or a lot of the guys that come into the internet, I actually return all those calls myself personally.
Wow.
And I'll spend, 2 hours on the phone with people. And you'd be amazed at the number of men who will either get emotional or, be unbelievably grateful because we took the time to talk to them about it and didn't just tell them this is what you need to do and get out of their room. Because that's the way they're treated. It's a machine when you go into a practice, and when you have prostate cancer, this is how we treat it, move on. And they have a lot of questions. And so I just tell people, take control of your own health care and know that the only person that's really looking out for you is you.
Yeah, and I think that's amazing about this too is to add the urgency that you help with, because obviously no one wants to hear that C word in their life, and it's not something you can procrastinate on, right? I mean, in everything in life, we can put it off another day. This is something you cannot put off another day. So, hey, Clete, thank you so much for your time. It is September being Cancer Awareness Month for prostate. And, of course, you can check out VituroHealth.com, VituroHealth.com on Facebook, Twitter, and Instagram as well. Clete Walker joins us right here on KCAST Radio's Kurre and Klapow Show. Thank you, brother. Have yourself a wonderful weekend.
Thanks,
Appreciate you.
There guys. Thanks very much.
There he is. Clete Walker joins us right here on the KCAST Radio. Well, another one of those great clients that you reached out to get and said, this is an important thing. We're two guys. We talk about these things. It's something that guys don't want to talk about.
That's
and
right.
Again, it's one of those things. And again, it's not one of those things like you can put off talking to your wife. You can put off doing your taxes. You can put off having to talk to someone at work. But when you find out you have cancer, you got to deal with it now, like this minute, and that's not something that a lot of people want to deal with, and so to have Vituro Health in your back pocket, and again, I never realized that you could actually talk to them and then do a second opinion for free for you, and it'll actually make that phone call himself.
This is what I love. I mean, I will say this is what I love about the people who work with us on our show. We have great clients, but our clients are doing some of the most interesting and innovative things, regardless of whether that's Backyard Adventures or Vituro Health. And Clete said it. Look, he's going to talk to you on the phone for 2 hours because this is about caring for you in terms of your health. That's why his company does what it does. And I was just, as you were talking, these are the people that work with Kurre and Klapow Show.
I love it. It's great.